Hi again and welcome to LifeWorks PRMC. I'm Roger Fallabout of the Community Relations Department at Peninsula Regional Medical Center. It's Heart Month in February. We've got a lot of things going on at Peninsula Regional, a lot of things for you to participate in. We'd like you to swing by the website and check those out at www.peninsula.org. On the program here today, we are very fortunate to have with us one of the newest members of the Guerreri Heart and Vascular Institute team at Peninsula Regional Medical Center. He's cardiothoracic surgeon Dr. Victor Kim. And Dr. Kim, welcome to the show.
Thank you very much. Thank you for inviting me here today.
Pleasure is ours. As we like to do with the show, we always start out by having our guests tell our viewers something about themselves. So for the next couple of minutes, the floor is yours.
Okay. Well, thank you. I guess I'll start by saying that I was born and raised in Arlington, Virginia, which is not far from here, just over the bridge, outside the Washington, D.C. area. So as a boy and growing up, I've spent quite a bit of time on the Eastern Shore, fishing with my dad and mom, and so currently I'm married. I have a great 4-year-old boy, and he loves the snow that finally came down.
Yeah, how about it? How did you know, or how young were you when you knew that medicine was going to be your chosen profession?
Wow, as far back as I can remember, I always knew. Well, I was always interested in the circulatory system. Whenever, even in grade school, when we learned about the different systems, the nervous system, so on, that always really interested me. And so I always had a sense that I would go into something related to that. And then as I got older and came across other things, it just slowly confirmed. I just went with my interest, basically, and so that led me to where I am now.
And your formal training?
In cardiothoracic surgery.
Yeah,
yes.
Where did you go to school?
Boy, that's that question has many parts because I did quite a bit of schooling. I did my undergraduate work at University of Virginia, where I majored in biology and minored in chemistry, and then went to the Medical College of Virginia for medical school. And then spent an intern year at Dartmouth, and before I had spent a couple years doing research with Dr. Chitwood at East Carolina. And that's actually where I completed my general surgery residency training. And then after that, I went to Yale for my cardiothoracic surgery fellowship training.
Anybody else in your family in the medical profession?
I do have some cousins, several cousins who are physicians, but prior to that, my parents were always interested in law, not necessarily medicine, so I'm not really sure how I became so interested in medicine.
Right. Let me ask you this. How does a doctor decide what specialty he or she wants to go into, and in particular, something as complex as cardiothoracic surgery?
That's a good question. So, I went through several phases as I grew up and went through my education. I always knew I was interested most in the circulatory system, and the heart really fascinated me. So I kind of had a sense that was an area of big interest for me, and so that's what I pursued. But then, when I got into medical school and I started learning about the whole human body, which is just an incredible thing, I think.
Yeah.
And I did my different rotations during my third year. The first 2 years of medical school are classroom and lectures, and then the third year is in the hospital where we do different rotations. And I did neurology, I did internal medicine, and I realized, wow, all these things really interest me. Now I really don't know what I want to do. But then I got to my surgical residency or surgical rotation, and I realized, working with my hands, the immediate fix, being able to help someone right away surgically. They come in with a problem and I can fix it. That really interested me. And then when I did my cardiac surgery rotation, and I can remember the first time I held the heart in my hand, it was
amazing. I'm sure.
Yeah, I don't have words to explain. So from there, and then I just realized, wow, this cardiac surgery is to me, it was the most complex and the most challenging part of medicine, part of surgery. So, I just felt like I just need to do that. I need to do the most challenging thing there is, and that really interested me. And then the fact that not only are you fixing something, but a lot of times you're giving patients a second chance.
Yeah, you really are.
Sometimes you know, you're in a position where you have to save someone's life, and just the gratitude that comes from that, and just the feeling that you get when I know that I've really helped that patient, giving them a second chance.
I have been lucky enough to be in the operating room and see open heart performed.
Yes.
It's an amazing surgery, and really, I wish everyone could see it because it is such an incredible thing to see. Does it ever become routine to you doing open heart surgery?
No. You know, friends of mine in medical school who went into other fields, other surgical fields particularly, is how do you do the same operation every day? And really it's not, although by name it might be a bypass surgery, but you know, every bypass is different, every patient is different, so no, it doesn't. And the fact that you have someone's life in your hands, how can that ever get boring or mundane? You know, you have to be on your toes, you have to be at your very best and completely on your game every day. So
yeah, no doubt about it. Let me ask you this too. I know that there's so much more to cardiac surgery than just open heart surgery. What are some of the other things that you specialize in?
Yes, so I do cardiac surgery, I do thoracic surgery, and I do vascular and endovascular surgery. So, you know, in addition to open heart surgery, I also do thoracic surgery, which is surgery on the lungs, lung cancer, pathologies of the chest, and then vascular and endovascular surgery is an area that really actually interests me very much as well. And I've really pursued that part of my career because I think one of the futures of cardiac surgery is really a hybrid between a cardiac surgeon and a vascular surgeon, where you're working not only being able to do open heart, but also being able to do things with wires and catheters and stents and balloons. That's what endovascular surgery is. And so that's what I do. I fix aneurysms that involve the abdominal aorta or the thoracic aorta. I fix those both open and also minimally invasively. I can do it, generally we can do this now through a tiny incision, an incision no more than maybe the width of your pinky, and through the groin, through an access in the groin with wires and catheters. So yeah, in addition to fixing blood vessel problems in the legs, you know, whether it's blockages in the legs or aneurysms involving different arteries in the legs, I guess generally speaking, I'm a surgeon that fixes arteries.
Dr. Kim, I guess one of the most important things in your profession is that you never stop learning.
That's very true. The field of medicine is advancing constantly, and new research is coming out with new treatments, plus the advances in technology, the instruments, the devices that are being used, and the methods of deploying those devices. There are so many fascinating things that are coming out and helping us to really treat patients. One of the key things, or one of the big movements, is really more minimally invasive. Everything's moving towards minimally invasive and allowing patients to recover quicker and get up on their feet and back to their lives quicker. So all of these things are really exciting.
Yeah, terribly exciting. You're kind of the new kid on the block too, aren't you? You've only been here for a couple of months at Peninsula Regional and with the Guerreri Heart and Vascular Institute. You liking it so far?
Oh, absolutely. I love it.
Where were you before coming here?
I was in New Hampshire, in Portsmouth, New Hampshire. I was in practice there for the last 9 to 10 years, basically doing all three of the above, cardiac, thoracic, and vascular surgery.
Well, clearly you could have gone anywhere, but you chose to come here. What was it about Peninsula Regional and the Delmarva Peninsula that attracted you to us?
Well, actually, I wanted to be on the Eastern Shore. When I decided that I wanted to relocate, first of all, I wanted to get closer to family. My parents still live in the Washington, D.C. area, and I have a lot of family in that area. But, Washington, D.C. area is so congested.
Sure.
Plus, I really like the Eastern Shore. I like the ocean. I like the fact that 30 minutes to the east we have the ocean, 30 minutes to the west we have the Chesapeake Bay and so on. So
really is a great place to live.
it is.
You've been here long enough to probably gauge pretty well the cardiac program here. How
Yes.
would you rate us, and what would you say about Peninsula Regional and the cardiac program we have?
Well, I was ecstatic to find that there was a cardiac surgery program here. And so then once I knew that, I started looking into it, and I found that it's a stellar program. It has a long history. The program was started back in the 1970s. I mean, they were involved in some of the first several open heart operations in the country. Open heart surgery didn't start too much earlier than that. So there's a long history and a long tradition of cardiac surgery here. And not to mention, I was looking for a program where not only can I do cardiac surgery, but I wanted to be in a medical center where we did everything. And truly, the team here does everything. Probably the only thing we don't do take care of our transplants.
Mm-hmm.
But as far as everything else, the complex, simple, you name it, we're able to treat it and take care of it and do the operations well. That's the other thing. Recently, PRMC, the cardiac surgery program, joined the Maryland Quality Initiative, which involves all the open heart surgery programs in the state of Maryland. And they get together once a year and they compare the results of the different programs in an attempt to try to make everyone better, to improve everyone's results, learn from each other. And one of the things we found out is, wow, the results from PRMC are really at the top. Plus we follow our data in the STS, the Society of Thoracic Surgeons database, and I know that the data is very strong, mm-hmm. and the results are very strong.
How important is it to you as a surgeon to have those best practices that your peers are doing, that you can draw on and incorporate into the surgical procedures that you're performing?
It's very important. It's all about results. We want to make sure we have the best results for the sake of our patients. We want all our patients to do well. So it's, whatever we can do to improve it, whether it's learn from others, learn from ourselves, learn from each other, working with each other. That's one of the other things I really I learned, which I really like, is the collaboration, not only amongst my partners, the other cardiac surgeons here, but different subspecialists or specialists. We have I don't want to get off the track a little bit, but we have a lung cancer thoracic oncology clinic, which is a multi-specialty clinic and involves multiple specialties all coming together, discussing patients and their cases, and together formulating the best plan for them. Not just surgeons, but pulmonologists, oncologists, radiation oncologists, and the same thing as far as we have a cardiovascular meeting once a week where cardiologists and cardiac surgeons get together in a room and discuss cases and come up with the best treatment strategy. So I think discussing and trying to come up with best practices is vital.
Mm-hmm. You mentioned earlier minimally invasive procedures and robotic procedures. Is that where you see cardiac surgery going? I know probably a lot of them, and you can tell me, are still performed open. Will there come a time, do you believe, when most cardiac procedures, and can most cardiac procedures, be done robotically or minimally through very small incisions?
I think everything is certainly headed towards small incisions. I'm not certain if robotics is necessarily the answer to that, but certainly it is another tool, another device mm-hmm. that allows us to do it minimally invasively. Whether it's through the robot or, as I was mentioning to you, a combination of open surgery and surgery, that endovascular surgery, where we use wires and catheters, and we can go through a tiny incision from the groin up into the heart. One of the programs that we're working on trying to develop and bring here is a TAVR program, which is basically replacement of the aortic valve. Traditionally, it's done through an incision down the middle of your chest and putting on the heart-lung machine and so on. But now, in the last 1 to 2 years, the devices have come out where you can go through the groin, or you can go through a tiny incision in the chest.
Wow.
And go through wire, using wires and catheters, put it in kind of like you deploy a stent. So more and more, I think those types of procedures, and who knows what other procedures and devices. There are many people out there trying to think outside the box and coming up with these things. But ultimately, I'm hoping that magic pill might come. People thought maybe when the statins, the Lipitors, those they thought maybe that was that magic pill that cured atherosclerotic disease, the plaque formation and blockages that take place. But someday, hopefully, but then again, maybe not, because if they came up with that magic pill, I may not have a job.
Yeah, that's true too. Until that magic pill comes, or if it ever comes,
right.
What can we do to take better care of ourselves, to be heart healthy?
Yes, and I think that's a very important question, because we really have to be vigilant in our own care. We really have to take that, take the initiative on that, and be conscientious about what we eat, exercise. You hear and see that all the time, but I can't emphasize how important that is. You really have to watch your diet, watch your cholesterol intake, control, if you have diabetes, control your diabetes. If you have high blood pressure, try to lower your salt intake, to use diet to control those factors. And then, of course, we have medications that help us. But if you can control your high blood pressure, your diabetes, if you have it, your cholesterol levels, by concentrating on what you eat and don't eat, and then on top of that, exercise. Exercise alone, you hear about these good cholesterols and bad cholesterols. Well, exercise alone can lower those bad cholesterols and increase the good cholesterol. So exercise and diet, I think, really are key to trying to lower or at least minimize the risk factors that are there.
Mm-hmm. Are these some of the conversations that you have with patients when they come to you? Obviously, most have probably already been to a cardiologist.
Yes.
By this point, and they're reaching out to you because they're needing that type of intervention that you provide. Yeah. What type of conversations will you have with a patient when they come to you seeking surgical care?
Well, it really depends on what type of surgery they're coming to me to seek. For instance, if they need open heart surgery and bypass surgery, a lot of those conversations have, as you stated, already taken place. So really it's more about the details of the procedure, the surgery, what it involves, what the recovery period is like, what are potential complications, what are alternatives. These are the things that we discuss. And for instance, if someone comes to see me because they have claudication, they have blockages in their legs and they're having problems walking, that may be more of an instance where I do talk about the different risk factors and making sure they control those risk factors. So,
on the other side of the coin, as a patient of yours, what should I be asking you? What do you want to hear me ask of you when I come into your office? What's important that I know about my surgery, about you, about your practice?
Well, I think, especially if you're coming to speak with me about having surgery, I think it's very important that you fully understand what the surgery entails, the details of the surgery. Of course, there are some patients who actually don't want to know the details of the surgery, but you should ask the questions so that you understand exactly what it entails and what the recovery is going to be like. You should also ask about alternative treatments. It's important that you're informed, because this is a procedure that's going to be taking place on you, and
sure.
So you need to be part of the decision and participate in that decision. Don't just expect someone to tell you need to have this done.
Yeah.
You need to participate and interact with your surgeon, and together come up with a decision to proceed or not to proceed, or different alternatives may be laid out on the table, and you have to choose, okay, this versus this. It's always, I always talk about risks and benefits with my patients, and I always want to maximize risks, maximize benefits,
right.
and minimize the risk. So this is what we're always trying to obtain. But if it's more like this, then maybe surgery is not the option, and we need to think about alternatives, or especially if the risks are higher than the benefits, then absolutely that's not the way to go. So.
Post-surgery, you know we have a very robust cardiac rehab program at the hospital. How important is that in my complete recovery? Making sure that I'm vigilant and participating in my cardiac rehab.
I think the cardiac rehab program is one of the better rehab programs in the country. In fact, they're nationally certified, and there are 4 phases of it. It's gone even beyond what I'm used to seeing in my previous practices and other hospitals where I was at. So it starts even before you have your open heart surgery, your bypass surgery. The cardiac rehab staff come to you in the hospital and meet with you and speak to you and introduce themselves, and it starts right there. And then it carries on afterwards, after you leave the hospital. There's an actual facility that you go to where you're monitored and you undergo an exercise program in addition to helping you to modify those risk factors that I just mentioned. I just mentioned a few of them, but you know, there's actually 4 phases of it. I just recently found this out as well. It doesn't stop with just those 2 phases. Then there's a 3rd phase where you maintenance of that exercise program and risk factor reduction, and you know, phase 4 is anybody else who even if you haven't had heart surgery and you want to undergo cardiac rehabilitation, maybe you had a heart attack, or maybe you're having some chest pain and you underwent a procedure to have a stent placed. So that's a place you can go to with professional monitoring nurses that monitor you while you exercise, and they can also help you to perform the exercises that you need to perform.
Yeah, absolutely essential. Final question, Dr. Kim. If I gave you the ability to look into a crystal ball, maybe 10 or 20 years down the road, where do you see cardiac surgery, and how do you see it evolving?
We kind of touched on that a little bit earlier in this conversation, but I think more and more we're becoming minimally invasive. Wow, 10 to 20 years, you know, so much has happened in the last 10 years even, and we've come such a long ways. It's really a little bit hard to imagine exactly what it's going to be like in 10 years, but maybe we'll have that magic pill. But I think definitely more minimally invasive, whether it's the valves. We have TAVR, which is the aortic valve position, but then there's devices that are coming out for the mitral valve. These are all done through tiny incisions.
So exciting times.
It is. It really is.
Absolutely. Dr. Kim, I want to thank you very much for being on the program. It's great to have you here. And again, welcome to Peninsula Regional.
Thank you very much.
Great to have you as part of the team. Dr. Victor Kim of Peninsula Regional Medical Center and CV Surgical at Peninsula Regional Medical Center and the Guerreri Heart and Vascular Institute. If you'd like to learn more about cardiothoracic surgery, you can certainly find that information on our website at www.peninsula.org. You can also find great information there about the events that are going on during Heart Month in the month of February. As always, we're looking for great ideas for this program as well for LifeWorks PRMC. If you have some, I'd love to hear from you. You can email those to me at roger.fallabout@peninsula.org, or you can call me at the hospital at 410-543-7142. So, until we see you again, take care of yourselves, be heart healthy, and we'll talk to you again soon.